Today you will be hearing from the Honorable Minister on some of our major program achievements and highlights. He will also be briefing you on the major health sector achievements within the 10 administrative regions, and there are some other projects that will be continuing for 2024 that he will also be briefing you on.
We have developed a hybrid program, and we have already recruited about 1,200 persons who are currently undergoing nursing training through this hybrid program. And many of them are from Region 6 and Region 5. And by the end of this month, we want to recruit another 1,000 nursing assistants. And their training is going to last for 1 year. So if you know of anyone who wants to do nursing or become a nursing assistant, just let them apply. We have a place for them. And when they finish training, we have a job for them once they are suitably qualified.
We have also been able this year to have a turnaround time in terms of diagnostics. In the past, it used to be that in some cases when we take a biopsy, it probably takes about 3 months, sometimes longer, for people to get back the results. And you can imagine the anxiety that people would be feeling. At the Georgetown Hospital, we have now been able to reduce that to less than a week. And we are going to introduce in the first quarter of next year telepathology. This is another project that we've been working with Mount Sinai on. We have already bought the equipment to do telepathology. We have started the renovation of a section of the Georgetown Hospital to accommodate this new lab. And once that is completed, we will install the equipment. We have already trained the staff of the hospital to be able to do telepathology, and they would be directly linked to the Mount Sinai lab. And basically what this would do is that we'll be able to take high-resolution images of the samples, and then a pathologist would be able to look at those high-resolution images and be able to make the diagnosis. So this is a service that we'll introduce starting from early next year because we have all the elements in place. It's just starting the service. So that would also improve the turnaround time in terms of diagnosing cancer patients. Now, when we look at our stats for this year, breast cancer remained the #1 cancer in Guyana. This year, we diagnosed 161 persons with breast cancer. This accounted for 17% of all cancers diagnosed this year. So this is something we have to work more on in terms of reducing this burden. And one way of doing that is that we have to encourage people to get screened and get screened early. Our approach to this now is with getting people to come out and do mammograms. So persons 40 years and older should come and get a mammogram. And if you have a family risk between 30 to 40 years, then you should at least, once you have a family risk, then you should also consider doing mammograms. So we need to encourage people to do more screening because that's the only way we will be able to catch these things early, prevent the spread of metastasis and so forth. And so the outcome for these patients would be far better. Down the road, we'll introduce genetic screening. This is another area that we have been working on. But breast cancer remains a challenge for us, and we have to work together to educate the population about breast cancer and to get more people into screening. We have one mammogram machine at the Georgetown Hospital, and we have been working with the IAEA to get another 3 mammogram machines, and hopefully as soon as they send them in, we have identified 3 hospitals where we will be putting these mammograms. That is New Amsterdam, Linden, and West End. The second most prevalent cancer among women is cervical cancer. This year, we have diagnosed 102 persons with cervical cancer, and this is approximately 11% of the cancers that was diagnosed for this year. Again, as we have been saying, there is a very cheap and effective method in preventing cervical cancer, and that is HPV vaccination. Unfortunately, a lot of people are not taking the HPV vaccine, and the new guidelines from CDC as well, from 9 to 15 years of age, you can now get a single dose HPV vaccine. If you were 16 years and older, previously this was not available, these are new guidelines. 16 years and older, you can get 2 doses at a 6 months interval, and that would help to prevent cervical cancer. Again, we will want to appeal to the media to help us to get this message out there, because we have HPV vaccines. What we want to do is to give these vaccines to more people so that they can benefit and we can help to prevent cervical cancer. We have some other programs that we have put in place to mitigate against cervical cancer. One is to do more VIAs, to do more pap smears, and we have introduced HPV testing. So all 3 would help us to detect abnormal cells. If you do a pap smear or a VIA and there are abnormal cells that are detected, then we have distributed cryotherapy equipment where the healthcare worker is able to then use cryotherapy on these abnormal cells. So this is something that is ongoing, and we are expanding these programs. In terms of cancer in men, we have seen an increase in prostate cancer. This year, we have diagnosed 107 persons with prostate cancer. This accounts for about 11% of all cancers that we have detected this year. And next year, we are going to launch a program dealing with prostate cancer, because this is an area that we have to also be able to detect these cancers early and help to mitigate the effects of these cancers. We have a number of other cancers that we have been working on, but I wouldn't go into that. So the 3 main ones would be in women, breast cancer and cervical cancer, and for men, prostate cancer would be our focus. Mental health, we have done a number of new things this year in mental health. We have done a draft strategy. Early next month, we would launch that strategy because all the stakeholders have agreed on this strategy. We have this year launched a suicide prevention commission based on the suicide prevention law that was passed in Parliament. We have also launched a new mental health board, again, in keeping with the laws that was passed in Parliament. We have introduced telepsychiatry, where we can use the equipment that we have for telemedicine and use them to do counseling for patients as well. In addition to these things, we will release later, or maybe early next month, the data for suicide. So far, we have seen a decline, and we want to verify before releasing the data, but the numbers are looking much better than they were for last year. Other programs that you will see us launch for chronic disease next year would include a more comprehensive program dealing with kidney diseases. As you know, under kidney diseases, we have been doing work with dialysis patients. Uh, this year, we have had 425 patients who are on dialysis, and that's an increase from the 330 that we had in the previous years. So one of the strategies is to work with patients who have kidney problems to prevent them from getting to end-stage dialysis or end-stage renal failure. And while we do have a program for chronic obstructive pulmonary diseases, this is a program that we want to expand and to make sure that we can help those patients as well. So you will see us work in two new fields with chronic diseases in a more expansive way. In terms of primary health care, our immunization program continues to do really well. We have had, during COVID, one of the antigens that we were giving was at about 87, 88%. And we have now recovered that because all of the antigens that we are giving now is now between 98 to 100%. We have introduced this year a new program dealing with school health. And generally, when we speak about school health, we talk about health education in school and things like that. We are going further than that. So with school health, what we have been doing is screening children going into school. And this screening involves a general checkup. And we would check the child's eye to see that to make sure that they're seeing properly. And if they need some lenses, spectacles to correct that, then we are able to offer spectacles to them. We are checking their hearing to make sure that they can hear properly. If they need a hearing aid, then they'll get that as well. And we do dental checkups to them. And if they have any problems, we fix that as well, and plus a general checkup. So far with that program, we have screened, let me get these numbers for you guys. So for first year nursery, we have screened 7,995 persons. And we have, for that first year, maybe another 5,000 or so children to screen. For second year nursery, we have screened 3,210. We have another 10,000 or so to screen to complete nursery. Now, the idea with these screening programs is that a child coming into nursery school would be screened at least once while they're in nursery school. And then a child in primary school would be screened at least once during their primary age. And then a child at secondary would be screened at least once during secondary school. So we have started this year, we have started at nursery. Next year, we are going to complete nursery, and we'll start with primary. And as you can imagine, it's a lot of children that we have to screen. But we think that this would be a very important program going forward. We have set up a unit within the ministry now to deal with this school screening program. And we have been collaborating very closely with the Ministry of Education. In terms of our MCH program, I want to highlight that we have started a program to prevent postpartum hemorrhage. That program was started last year, and we are very pleased to report that we have had no case of any mother dying from hemorrhage. And I think that's a significant achievement for us in the ministry. We have also been introducing waiting homes, and these are buildings that we put in the compounds of our various hospitals so that a mother who is expecting to deliver soon, instead of them waiting in their village and then when they go into labor, then try to get to the hospital. What they do now is to come to the hospital earlier. They stay in the waiting home. When they go into labor, they go across to the hospital and they have a very safe delivery. After delivery, they go back to the home, they wait a few days. Once everything is okay, then they go back to their respective community. So we have now in operation 16 waiting home, and this year we were able to put 2 new ones into operation. In terms of in the area of dentistry, we have been expanding our dental clinics. We have close to 105 dental clinics in operation. Over the last year, we have put another 6 into operation, and we've been expanding the services. The numbers are quite big, the amount of interventions that we've had this year. We have seen, or we have done more than 140,000 interventions for people in dentistry. But we can give you those details later. In terms of ophthalmology, we have also been expanding our services where we are able to do more eye care, and we have a spectacles program. One of it, which we have been using in the interior, is called Snap-on Spectacles. So we are able to come into the village, do the test right there, and within five minutes you get a spectacles with the right lens. So that program is an ongoing program, and we have been able to help a couple thousand people with that program. In terms of detecting cataract, our teams, we send them into the different communities. They'll work with people. They make a list of all those persons with cataract, and then we bring those persons out. We take them to Port Morant, we operate on them, and then we send them back into the interior. This year, we have been working on our digital health, and we're hoping that by next year we'll set up a new department regarding digital health in the ministry. Hopefully this would be a 9th program that we'll have in the ministry. And with digital health, we've been doing quite a number of things. This year, you've heard us talk about electronic health records. And so we have gone out to tender to have a comprehensive electronic health record system. And we have had 16 companies that bid to provide a solution to us. And we have evaluators that are going through these bids. And hopefully they'll narrow it down, and then we'll get one company that we'll be working with. You have heard us talk about telemedicine, and we have telemedicine equipment in 25 sites across regions 10, 9, 7, 8, and 1. And this has been helping us to reach very remote communities. And the equipment that we have and the training that we have given to the healthcare workers would include them being able to set up the equipment to do ECGs and to also do ultrasounds. So with telemedicine, we are able to connect rural communities with some of the doctors at Georgetown Hospital. And by doing these types of diagnosis, we are able to more accurately determine whether a person would need a medevac or not. We have done a lot of work on health infrastructure over the last 2 years. This year in particular, we have spent $2 billion upgrading 271 health posts and health centers. So 210 health posts and health centers were upgraded, and 61 accommodation for staff. And we've spent about $2 billion doing this in all the regions. Surgical theaters, we now have been able to add surgical theaters to the Diamond Hospital, which is now operational, to Aishalton, to Maruka, to Madhya, and to Maikoni. And these are all functional. Madhya, for example, is the first time they have an operation theater. Maruka, similarly, Aishalton. The first time they're having these facilities. We are expanding the district hospitals at Camarang, Port Kaituma, Anai, Karasabai, and Sand Creek. So these projects are on the way, and by mid of next year, we're hoping that they can be completed. If we are putting in theaters, and we can do cesarean sections, we also want to improve the neonatal care that we are offering to the children that are born at these facilities. So we have been improving the neonatal units at a number of facilities. This year, we have added equipment to 6 regional hospitals. Prior to this, they weren't able to provide neonatal care. So we have now in 6 hospitals neonatal units, and we have trained people at these hospitals to be able to deliver care. Our mortuaries in some of our regional hospitals would have been in a very deplorable condition. And so we have upgraded mortuaries in regions 1, 2, 3, 5, 8, and 10. And so this is a program that we have to upgrade these facilities. Not only the mortuaries, but if we need to do postmortem at these facilities, that we are able to do the postmortems there. Waiting homes, I spoke about that. This year, we started the construction of 2 new nursing schools. One would be at the Saudi Hospital compound, and the other is at New Amsterdam. In terms of regional hospitals, we have 6 hospitals that are currently under construction. One at Lima in Region 2, one at Dekendren, one at Diamond, one at Enmore, one at Bath, and one at Skeldon. Now, for all of these facilities, we have completed the foundation, and you would see over the next quarter, you would see the infrastructure starting to take shape. And all of these 6 hospitals, we are expecting the physical infrastructure to be completed by the end of 2024. And then we'll start the equipping and making sure that the facilities are functional. So by early 2025, all of these facilities should be operational. And just to remind you what these facilities would have, they would have a 24 hours accident and emergency. They'll have 24 hours lab. They'll have a new suite of imaging, which includes ultrasound, digital x-rays, CT scans. They would have 2 operational theaters, surgical theaters. They'll have a minor theater, outpatient facilities, and a 75 inpatient facility. So these are the new regional hospitals that are being constructed. In addition to this, we have right now the Maternal and Child Health Hospital that is being constructed at Ogle. That's a 256-bed hospital. And the foundation for that hospital is already laid. And you're going to see the other infrastructure going in place during the next quarter. We have also signed this year the contract for the construction of a New Amsterdam hospital. And that would start in the new year. The foundation, you would start seeing in the first quarter them putting in the foundation. This hospital, again, would have about 220 beds. It would have 4 main operating theater. It would have a cath lab. Apart from the digital x-rays and CT scans, it would have an MRI. We'll have a separate theater for cesarean section, a modern accident and emergency, a modern lab. So this would be, when it's completed, it's also going to be like at a level 5 hospital, meaning that we can do a lot of surgical procedures that we are not able to do at New Amsterdam right now. In addition to that, it would also have a building there for teaching, and we'll have a building that we can house psychiatric patients when they have acute psychiatric episodes. So we are moving away from this model where patients have to stay with us for extended period and going to a model when you have an acute episode, you come in, we treat you, and then you go back to your community. Apart from the New Amsterdam Hospital, we also would start we'll put out for bid the Bartica Hospital because we are finalizing the design. And once that design is finalized, we'll go out to bid for that hospital. Early next year as well, in the first quarter, we are going to put out a tender for the new Lethem Hospital. And we are hoping also to have the tenders ready for the new hospital at Moruca, Keto, and Camarang. So these are the hospitals that we'll be building over the next 2 to 3 years.
Last year, under the instructions of the president, we went out to tender to have an electronic medical record system. And we are currently evaluating 16 proposals that were submitted to us. We are hoping that from those 16 proposals, we'll narrow it down to 6. And from those 6, we'll be able to select one vendor this year to ensure that we can have digital health in Guyana.